Hey, it's me, Catsby. Sometimes it's really surprising how time flies. And looking back, it's been 3 years since I've made a mental health video. Things got super chaotic when the pandemic came, and that's about the time that I made my last mental health video. And then I was dealing with a family emergency that lasted several months. And then I went through a job search, and my partner went through a job search, and I've moved. And I got really burnt out in the middle, and YouTube was the thing I decided to set down. And so now I'm back and I'm really excited to be here. I've missed this. So thank you for being patient with me as it took a while for me to get back and set up. But I'm really glad that you're here. I'm glad that I'm here. And I'm excited to start going through mental health content again. So today's topic is, how does depression affect your hair? How does mental health affect your hair? And I wanted to talk about how I chose this topic. And I noticed that in a lot of media representations and also real life celebrities who went through something relating to mental health, it was often accompanied by a drastic change in their appearance and specifically their hair. A couple of these that I noticed: one, there's a movie with Adam Sandler called Big Daddy, and there's a part where he is like, oh, you can tell this guy has issues with his father just by the way he looks. So see if I can play that scene here.
Look at this guy over here. He's probably a nice little boy just like you. Then his dad messed his mind up. Now look at him. Hey, buddy, who won the Jets game, you know?
Who cares?
Let it go, pal. He can't control you anymore.
What are you talking about?
You know what I'm talking about.
Yeah, you're a loser.
You're mad at your dad, mad at me. I forgive you.
Yeah, man. Father.
That was one of them. Another one is Life is Strange. If you've played that game, there's a character named Chloe, and spoilers for Life is Strange ahead, but when she's younger, her hair, looks like typical brunette, blondish, long, straight hair. And then after she goes through a really difficult, traumatic life event, then her hair gets cut really short and she dyes it blue. And going to those real life examples, one of them is Emma Watson, that when she was done filming the Harry Potter series and she kind of wanted a fresh start, she went with that famous pixie cut that she got. And finally, of course, thinking about Britney Spears back over a decade ago when she was going through some really, really tough mental health stuff, she famously shaved her head. And so it got me thinking, maybe there is something related to mental health and hair. And I wanted to see if the research confirmed that. But on a more personal note, I also changed my hair really drastically when I was going through my mental health struggles, the worst of it, when I was in high school. And my hair has always been like this, pretty long. But first I decided to cut it short all the way up to my shoulders. I know that that's not super short in the scheme of things, but for me, it was the shortest it had ever been in my entire life, and it didn't quite feel like me. And then after I cut it short, later I had another almost compulsion to bleach it blonde. And after it was done, it didn't feel like me at all. It made all of the mental health things that I was dealing with a lot worse. And so I wanted to know, was that me, or could there be something in the world of psychology that can explain why that was something that I felt the need to do? And stick around toward the end to see a picture of me when I did have my hair bleached blonde. So now, diving into the research, here's what I found out. First of all, your appearance affects your mental health. According to the research, being unhappy with your body image can lead to poor mental health outcomes. I read a paper called Changes of Appearance in the Presence of Major Stress Events, and this is what it said. A central component of body image and bodily satisfaction is physical appearance. And taking a step back, since this video is both about the research but also about my own personal experience, I was in high school at the time, and I think everybody knows that just being in high school is such a hard time for yourself and your body image and all of those things. And I was certainly no exception. But on top of that, I was also participating daily in figure skating, training, competitions, tests, all that stuff. And I will say that the world of figure skating is also not a super great place for mental health and body image issues. So it was just compounding from the usual stress and pressure of high school and how you look, combined with the ultra fixation on figure skating, with not only how you look, but how your weight and your strength and your composition affect how you perform on the ice. So it just felt like I was under so much scrutiny, and maybe even an increased level for being in that world that's just not really known for having healthy body perceptions. What that paper also said changes in appearance in the presence of major stress events is that internal negative evaluation of one's physical appearance or body image dissatisfaction may result in negative affective symptomatology, including depression, anxiety, and hostility. So this is that exact quote about how these poor perceptions of body image are correlated to increased rates of poorer mental health outcomes. So that is what this first paper introduces, is that there is some connection between poor self-image and poor mental health outcomes. I also wanted to dive specifically into not just your body image with mental health outcomes, but specifically your hair. So that's what this next section is about. I read another paper, and this one was titled Changes in Appearance and Psychosis, and all of these will be linked in the description below. And this one says that there is a link between psychotic decompensation and hair cutting that's been reported in a number of case reports and small series studies. So basically some connection between your mental health going in a worse direction and cutting your hair. Diving straight into what they found out, they said, quote, in a sample of schizophrenic patients where the number is 34, that 41% of them had drastically altered their hairstyles prior to admittance to a psychiatric hospital. The authors argue that this phenomenon is clinically significant as these changes were made before other overt signs of psychotic decompensation were observable. So this study found a link between psychotic decompensation, which in this case specifically they were looking at schizophrenia, and hair cutting, and they did find that correlation with the quote that I just read out. But I wanted to know, is this generalizable? I don't have schizophrenia, and I wanted to know, does this apply to depression or other mental health conditions? And the research says that yes, that this is generalizable. And the next set of stuff that I looked into is talking about research that says that simply experiencing stressful life events can impact appearance. So the third paper that I wanted to introduce to you all today that I went over is called Changes in Appearance in the Presence of Major Stress Events. And the quote that I wanted to call out from this paper says, the present research has demonstrated a significant relationship between experiencing stressful life events and altering one's physical appearance. These findings offer a glimpse into the construction of body image by suggesting that the way one perceives and displays oneself physically is closely related to one's inner psychological world. So basically saying that how we appear on the outside is a reflection of how we appear on the inside, including our mental health and our mental health states. And so these authors looked into, is there some correlation between changes in those appearances and changes to one's mental health or experiencing major stress events? And another part of that paper that I wanted to call out says, body image dissatisfaction as a consequence of stressful life events may provide the direct motivation for changes in body appearance to promote self-image. A marked alteration in appearance may not be change for change's sake, but rather an important indicator of a shift in the internal perceptions of self. So basically what they're saying is that there is some connection between experiencing a major stress event, having some internal shift of perception, and then that internal shift reflecting externally. And again, stepping back to my own story, at the time I was going through some really hard stuff with my own depression. Like I mentioned, I was in high school, I was in figure skating, just worlds that are very tough, especially on young women, about how they look and their body size and appearance and all that kind of stuff. And at the time, I remember feeling incredibly uncomfortable in my own skin. And reflecting back on that time, I remember thinking, I feel really unhappy. I don't understand what's going on. So maybe I need to change something and that'll bring me back to a happier state. And what I remember thinking is that I was happy when I was younger. And I think like a lot of people with this kind of hair color, when you're younger, it's actually very light and it darkens with time. And that was part of the reason that I decided to go with such a drastic light color, is that it looked like the color I had when I was little. And maybe that would bring me back to the happiness that I had when I was little. Another thing that crossed my mind when I was thinking about all of this is that I, again, remember just feeling unhappy, not really understanding why or how to fix it, but wondering if I could pinpoint what it is that was wrong with me. And one of the things that came out of that self-reflection at the time was that maybe my hair is the problem. And the reason I felt that way is that, one, in my high school, at least where I went to school in central Pennsylvania, all of the really beautiful girls at school and kind of that perfect image that was shown around was these people with these straight long hair. And my hair is obviously not like that at all. And it was even messier when I was younger because I didn't care very much about maintaining it and I didn't know how to maintain curly hair properly. So it definitely wasn't an asset that was really appreciated by the people that I was around every day. And I think also society was really mean to people with curly hair at that time. I think still there's some ways that they can be not nice. But thinking back, I grew up in the heyday of the Princess Diaries, where the big scene is Mia going through her transformation from ugly loser high school kid to princess. And what was part of that transformation? Getting rid of the curls, the scene where the hairdresser is forcing a hairbrush through her hair, trying to get rid of it, and he breaks the hairbrush, that kind of thing. So it was just not a good time to have curly hair. And I think that that was also something that I pinpointed as like, this is what makes me different than everybody else. This might be what's making me unhappy. So maybe if I cut off my hair, maybe if I change my hair really drastically, I'll fit in, I'll be happy. I won't feel so ugly and horrible all the time. Jumping back to the research, again, that changes in appearance in the presence of major stress events. There was another section that said, alternatively, an individual may be reaching out non-verbally to a particular social group or category to altering physical appearance in a manner that matches that group. So kind of different from that first section, which is just saying that changes in internal perception of self can reflect externally. This section is talking about that it might be very particular changes that folks are doing in order to fit in better, to make themselves a part of a different social group. Now, I wanted to take a step back and go through this paper and talk about what is a stressful life event in the context of this paper. And again, just looking at my monitor over here with the different ones called out, they defined a stressful life event as, quote, a critical stress event of personal significance. And some examples include death of a loved one, loss of a friendship, or experiencing a breakup. Mixing the research with my own personal experience, those three that they called out as these top major stress events as examples, quintessential examples for their paper, are things that I was going through all at once. That year that I got diagnosed with depression, I had 5 family members die, so we were kind of just in like constant funerals and funeral planning. Loss of a friendship was another major thing that I was going through, and I went through like 2-ish breakups in the period of that year as well. One of them very difficult and very hard on me. Just seeing my experience reflected so acutely in this paper was very validating, that not only is there just a correlation between changes in mental health or your perception of self and then reflecting externally, but also that it's tied to these specific events that I was going through at the time. Another interesting thing that the research called out is that these major stress events are more likely to affect younger people than older people. Going back to another quote from a paper, it says, thus, younger individuals may more readily encounter critical stress events of personal significance. Younger individuals tend to place greater importance on establishing interpersonal and intimate relationships than older individuals who often have already experienced these developmental identity tasks. You're more at risk when you're younger because these major stress events that they're calling out are more formative and more central to your identity at that point in your life. Whereas when you're older, you have more of those experiences in the bag already. When you're younger, this is new, this is foundational to who you are. And so these changes can be that much more impactful. The last thing that I wanted to look at and answer the question with my personal story is, how does mental health affect coloring your hair? And from the research, it looks like that's another piece that can be affected. So again, looking at that changes in appearance article, it said the most commonly made or considered changes in appearance included weight changes, working out to alter body shape, tattoos, and changes in hair color. Changes in hair color was one of the top things that was called out as part of the research, but none of this really answered why. So that's the next thing that I wanted to dive into. So the first reason that the research talks about is that it can be a coping mechanism. What the paper said was, quote, the occurrence of appearance changes in association with stressful events highlights the transformational role of these events as motivators for intentional self-change as a coping mechanism. So the first thing is that you're going through something really stressful, and this can be a way to help cope with that, maybe regaining a sense of control, maybe just feeling like you need a change to feel better, which is something that I was going through. And going back to my own experience again, for me, it was that all I knew is that I felt like there was something very wrong. I was feeling sad all the time. I didn't feel like myself. I didn't feel okay in my own skin. And I felt like there should be some explanation of what was going on, why I felt that way. And so I started taking shots in the dark to explain and kind of guess and check if I understood and could change what I was feeling. And I thought that changing my hair could make me feel okay again, that maybe this is the thing that needs to change for me to not feel the way that I'm feeling. Obviously, it was wrong, and it turned out to be a diagnosis of a mental health condition. But at the time, I didn't know it was happening. I just knew that I felt really bad and I needed that to stop. And so I tried something different, and it didn't work, but well, I tried. The next thing the research said is that it can be a cry for help. Quote, from a clinical perspective, the current research suggests that frequent or subsequent changes to physical appearance may be an external indication that an individual is undergoing significant multiple life stressors. Dramatic, major changes in appearance thus may signal a person in emotional distress and in need of strong interpersonal support. So continuing on, Campo et al., another paper, determined that frequent appearance changes may act as an indicator or predictor of susceptibility to a mental disorder such as depression or anxiety. A patient's alteration to his or her physical appearance may very well represent a meaningful nonverbal behavior, communicating to the therapist that an important internal event is occurring. The decision to alter appearance may reflect underlying concerns or conflicts, and external changes to appearance may occur before an individual has the ability to verbalize internal changes. This quote was so powerful to me, just really touched a nerve, because like I've been talking about this whole video, this is basically exactly what my experience was. I didn't really know what was going on, so I was just trying to change things and just not be myself anymore because I thought that that would help. And I didn't know what I was going through. I love that they called out nonverbal because I couldn't tell you what was going on. Like up until this point in my life, I could trust what my emotions were telling me. And I didn't know that I had this mental health condition now, and that there was emotions that were going to be exaggerated or not genuine or not based off of events that happened. I just, up to that point in my life, my emotions made sense, and I could point them, oh, I feel sad because this happened, or I feel happy because this happened, or I feel fine because nothing happened, and that's just my neutral state. And so changing to a state where that's not the default and that my emotions are different and exaggerated was a very unexpected transition and a very confusing transition. And so to me, the changing in the appearance was definitely a cry for help, and was very close in time to when I was getting to the point that I was in a really unsafe spot. I didn't have a therapist at the time. It hadn't even occurred to me I hadn't had one up until that point in my life. And so there wouldn't have been a therapist that was able to see this and understand that something was going on. But I do wish that somebody had been paying attention and understood what it might mean. On the flip side, once I was put into therapy when my depression diagnosis was identified, I had changed back from my super bleached blonde hair, dyed it basically close to my natural color. And I still remember that my therapist didn't notice. And I came in expecting him to say something to acknowledge, like, hey, you look really different. And for me, it felt like a step of healing, of feeling more like myself. And so for him not to even pick up on that, it just felt very not personal. It felt like he didn't remember me, didn't care about what we had talked about. And that was hard. And so I do think that it's really important, at least from my own experience and reading what's written here, to keep this in mind. Because for me, it was definitely a big part of my story. And maybe if somebody had noticed, I could have figured out what was going on sooner. Another reason that may contribute to why people feel like changing their appearance when they're going through these major stress events is that it can be an indication of psychological issues. So one of the papers that we talked about today specifically talked about schizophrenia, and these changes in appearance can be related to a loss of connection with reality. Another way that this can present in terms of these psychological issues can be a loss of connection with the identity or self, which was my case. Just really feeling like I didn't know who I was anymore, and I needed to change my appearance to try and figure that out, to try and feel better, to try and just troubleshoot my emotions and what was going on. Another paper that I read was called The Urge to Change Appearance in Different Psychopathological Categories. And that one said, based on our own findings and those of others, we tend to regard the association between changes in appearance and pre-psychotic symptomatology that was found as a reflection of the loss of ego boundaries, identity, and inadequate sense of reality. So basically, there's this connection between loss of identity or loss of touch with reality on this decision to change your appearance. So the last thing that I wanted to talk about to wrap up this video is what I think you should do with this information. So the first thing I recommend is to pay attention. You should pay attention because you could be seeing something like this happening in somebody else, somebody you know. Now, I do want to caution that it's not always appropriate for you to intervene or to interfere in somebody's personal life and their issues, but there may be times when it is appropriate. So use your judgment if it may be something that you could help with, or it's for somebody really close with you that you have that kind of relationship where you could see like, hey, I noticed you like change your hair. Is everything okay? That said, more than just using your judgment, I encourage you to get training. There is something called mental health first aid. I've taken it in the past, though my certification is not currently active. And it teaches you how to identify somebody who may be going through a mental health crisis. And what you can do is kind of a first responder similar to physical first aid to help the situation and connect this person to the help that they may need. So I do recommend taking a course like that so that you're more informed and prepared if the situation should arise. But also for paying attention, I recommend you pay attention to yourself. And if you find yourself feeling compelled to majorly alter your appearance, ask yourself, is this something that I really want, that would be appropriate for me, that would really actually make me happy? Or could it be that I'm going through something stressful at the time or just having changes in identity that are making me feel like I want to make this major change to my appearance? And make sure that it's the right thing for you to do before you go ahead and do that. For me, changing my hair was such a huge regret. It was embarrassing. It was almost traumatic, if I dare use that word. But it was super. It felt awful, to be honest, and I already felt awful. So this is somebody with clinical depression telling you that something I did made me feel even worse. And that was a hard bar to put lower at that point in my life. So I wish that I had known, and I wish that I could have asked myself, is this really something that I could do and make myself feel better? Or is it maybe just something that I'm feeling compelled to do because I'm just going through a lot right now? So I wish that I had known that and could have just avoided that whole embarrassing situation that I look on with a lot of regret, but also a lot of empathy, because I know the reasons now that I did it and understand what I was going through and why I made the decisions I did at the time. It's still hard. And the research also says this as well, especially for therapists. They say, thus, therapists are often aided by addressing noticeable changes in a client's appearance in light of the possibility that the change may reflect a recently experienced significantly stressful event. And going back to that story that I told earlier, I still remember that my therapist didn't notice when I changed my hair back, and for me that was such a huge change in myself. And it felt like a miss on his part, and it really affected how I perceived our relationship. So I will say that as the person that's been on the other side of therapy and receiving it and gone through this, that I do wish that my therapist had noticed and said something, and I still remember that 13 plus years later. So the last thing I want to leave you with is to be kind. If you see someone who does a major change in appearance, just remember that that could be because they're going through something, even if you don't know what that something is. Because again, this happened over a decade ago for me. And I still remember walking into school the day after it happened, and one of my teachers making fun of me that there was a glare in the room. He announced it to the whole class that there's a glare in the room because my hair had changed. And I remember people walking up to me at the grocery store and laughing at me about how I looked. And worst of all, I remember the person that I was supposed to go to prom with, the person that most of all, more than anybody, was supposed to make me feel beautiful and loved. And he saw me the day that I changed my hair, and he just backed away, saying no over and over again with this horrified look on his face. And that's still with me all these years later. For me, this was a cry for help. I just knew that I was feeling awful and I wasn't feeling like myself, and I felt ugly and terrible, and I needed to change because that state was not something that I could live in. It wasn't safe and it wasn't healthy. But I took a guess at what could fix it, and I was wrong, and it made it worse, and everybody's reaction to it made it even worse than that. So if I leave you with one thing, just remember to be kind to yourself, be kind to others when they may be going through things like this, because it's already really hard, and your opinion of how they look on top of that doesn't help. This is what I looked like with my bleached hair.